Just a little jingle to ease us into this very rich conversation we're going to be having with our two guests. They are medical doctors. We have with us, ladies first, Lamuella Chin. Good morning.
Good morning, ma'am. Thank you for having me.
Welcome to Cameron Feeling.
Thank you very much.
And right next to me, I have Mr. Nsia. Freddy, you are welcome.
Thank you. Thank you so much.
And you're both representing Heart Savers Initiative.
Yes, we are.
Okay, before we delve into the topic of stroke, because World Stroke Day is going to be marked tomorrow, and those days exist so we can have conversations that save lives, let's talk about Heart Savers Initiative. What is it about?
Well, Heart Savers Initiative is a non-profit organization. We aim at improving the morbidity and mortality of heart failure in Cameroon.
Yeah.
So when I'm saying morbidity and mortality, I mean to reduce the death and to reduce the consequences that heart failure has on individuals. So heart failure is basically, in simple terms, your heart doesn't work properly, your vessels don't pump blood properly. So any heart disease basically will end in heart failure eventually.
Yeah.
So that's what we're trying to prevent in Cameroonians.
How long has this initiative existed, and where exactly, how many regions, for example, are you based?
Okay, for now we're based just in Cameroon.
Okay.
The CEO is not based here, he's in the United States. But we have many permanent workers and volunteers like myself and my colleague who work with the screenings, the campaigns, the talks like these ones on site.
Okay, before we get into the stroke talk, give us like maybe just 3 things we can do to keep our heart healthy this good October 28th morning.
Yes, so one of the main things I will say will be to stop smoking. Smoking is one of the leading causes of cardiovascular complications. You stop smoking, you eat healthy, and then you take your medications when you have certain conditions diagnosed.
Yeah, and first of all, make sure you see doctors before you start taking any medication, because sometimes we feel we know too much and it gets us into trouble. Let's get into our talk of the day, stroke. Many people think they know what it is, but there's nothing like having health experts here to simplify it. Please, no jargons. As simple as possible so that mama who's watching this morning will understand what a stroke is and what exactly happens to a person's body when they're suffering from a stroke. Who can tell us that? Yeah, okay.
Okay, so stroke is a brain attack. Okay. So stroke is like the heart attack of the brain. It's a sudden interruption of the blood flow to part of the brain that is sometimes interrupted suddenly.
Yeah.
Now preventing the brain from receiving oxygen and nutrients, especially glucose, therefore leading to loss of brain function. So it's either caused when the blood vessel carrying blood to the brain is blocked or it ruptures.
Oh, wow.
And when it's blocked, we call it ischemic stroke, and when it's ruptured, we call it hemorrhagic stroke.
Which one is more serious?
The two are serious.
The two are equally serious.
But what is the most frequent is ischemic stroke. But the one with the higher mortality is hemorrhagic stroke.
So what happens when someone is suffering from a stroke? How would you be able to tell physically?
Okay. So what happens generally for a normal person, I like to use the acronym BFAST. BFAST. Okay. The B stands for balance. That is, you are with somebody and there's a rapid loss of balance. That is, it's not capable of standing like straight, like you just fall like directly like that. The F stands for face. You realize that one part of the face is shifted to other part.
Okay.
The A stands for arm. He's not capable of raising the arm, or maybe there's a weakness.
Wow.
And then say B first. And then the S stands for speech. There's a slurred speech or incoherent speech. And then the T, what is the most important for me, is time for time. Because the earlier as you realize that those symptoms, you have to note the time and then carry the person to the hospital. Because when somebody has stroke, for every 1 minute after stroke, you are going to about 2 million brain cells are destroyed.
Wow.
2 million brain cells are destroyed each minute after a stroke. That's why it's important to bring the person directly to the hospital.
Okay. So let's just have a scenario where you at home, unfortunately, we don't wish that, you notice that someone next to you is suffering from a stroke. What is that person supposed to do? Is there anything the person can do before rushing the sufferer to the hospital?
You should not wait. You should not
Okay.
directly as you see, you have to note the time because it's important to know the time because the treatment also depends on the onset of the symptoms. So you have to directly carry the person to the hospital without waiting. If you can call an emergency center, if the emergency center is capable of transporting the patient to the hospital before you do, you should wait for them. In
Yes.
case not, you should just bring them directly to the hospital.
Okay, let's talk a little bit about what actually causes a stroke. You talk about, let's first focus on professionals because that's our focus of today. Most of us professionals, we deal with a highly stressful work environment, and then sometimes it's a very sedentary one as well. Could those be some of the causes? And then you tell us how that leads to a stroke.
Okay, I like that you use the word sedentary. Maybe many people don't know what sedentary means. It just means that you sit down and you don't do anything. So you might think that you work so hard, maybe that's enough physical activity for you, but sitting in front of an office for 8-9 hours a day is not work. So if the American Heart Association recommends 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise per week for you to be considered not sedentary. So what does this sedentary lifestyle do? When workers, especially Cameroonian workers, go to work, they sit at their offices. Many of them leave their homes early because they don't want to be caught up in traffic, so they don't make food at home. They reach the office, they buy food from the streets. We don't know the oil that was used to cook that. You don't know what happened, whether they baked, whether they fried, whether you eat that. You don't know where that's from. You sit the whole day again, you don't do anything. You drive home, you were still seated, you didn't do anything. You reach home very late. Still, you have to socialize with your family, you have to catch up with friends, you have to do one or two things. You go to bed really late. Sometimes Cameroonians go to bed at midnight, which is really bad because sleep plays a very big role in your overall health, not just even cardiovascular. So that's it. People who work really hard don't get enough sleep.
Yes.
They don't cook their own meals, so they eat wrong. They don't exercise enough because they think that they have to be working round the clock. And like you said, when something will happen to them, they will be replaced the next day.
Yeah, that's true. And the other thing that's a bit tricky is in maybe the housewife watching this morning will be like, I don't need to exercise. I'm on my feet the whole day. I'm walking, I'm cleaning, I'm dry cleaning. And so does that mean I still have to leave some time for exercise when I'm already physically active throughout the day? What would you tell that person?
I will tell her she should.
Okay.
She should, because taking 20 minutes out of your day every day won't cost you anything. It won't cost you anything to leave your chores and say, okay, I finished dry cleaning. Before I come and do the dishes, let me go outside and take a jog around the neighborhood and come back. That will save you so much time. It will add you so many years to your life. And you'll find out at the end of the day, you feel happier, your mood is lifted, you feel lighter, and then you've reduced half of your cardiovascular risk factors.
Okay, so what's the relation between stress and a stroke?
Stressed people, like you said, their moods are horrible. They spend their time stressing. They don't eat properly. They don't exercise. They get into depression. Many people are depressed undiagnosed. They have never met a psychologist who has told them their diagnosis. So they are stressed and they walk around really sad. They don't know what's happening to them. They do not eat well. They have bad relationship with people, and people do not take care of them in return when they are sick, because people being around you has been clinically proven to make you heal better in the hospital when you're hospitalized. So when they get a minor ailment and then there's nobody around them, they just get worse and worse and worse, and those things increase your cardiovascular risk.
Wow, okay. Let's talk a little bit about some of the daily decisions we can make. Maybe you've said a few, but if you have any more to add, the daily decisions we can make to stay free of stroke. What can we do every day?
Okay. Firstly, we'll start with eating. Since we had a nutritional talk on we will start with eating. You should avoid processed foods as much as you can. Some people turn to processed foods maybe for financial reasons, because to cook for yourself is a little bit more expensive. Okay. But it is the better option. Avoid processed oils. Go for virgin olive oil, extra virgin olive oil. Go for canola oil, sunflower oil, oils like that. Eat fatty fish. If you can, leave red meat and go for fatty fish and white meat. So like salmon and chicken, things like that. If you can, try to bake instead of fry all the time. Okay. Yes. If you can also eat more better fats that are found in vegetables and fruits. Avocado, for instance, it's a very good source of fat. People should consume avocados in their salads more, things like that. When people have hypertension, because hypertension is the leading cause of strokes, people who are hypertensive tend to be very stubborn because they feel like their diagnosis is already a doom upon them. No, take your medication, do your test, visit your cardiologist, and you'll be fine.
Okay. Another thing that many people don't talk about a lot are people who have already suffered from a stroke and now they're living with us. What are some of the things we can do to make sure it never happens again or just make life easier for them?
Oh, thank you for that. The prevalence of recurrence of strokes is about 14.3% in Cameroon, which is quite high compared to the West and other countries. People usually relapse because they have their first episodes and they go back home and they continue smoking, they continue drinking, they do not do their physical therapy, and then they come back 3 months later with a stroke. And so when your stroke recurs, you're 3 times more likely to die.
Wow.
From that episode.
Okay.
When your stroke recurs. So when you go home, take your therapy. There are many things that can be given to prevent the next stroke. There are antiplatelets, anticoagulants. You take them, do your physical therapy, do your occupational therapy, and do your psychotherapy. Always, people usually neglect that part when they give you the ordonnance and they say, go and see your psychologist. Some people don't do that, which is really bad because, like I said, a majority of your rehabilitation is going to be mental.
Yes. And you need the right people around you that understand how to keep you healthy.
And the right finances. Your family needs to prepare financially and morally to support you because it is very expensive to have a stroke patient. They stay in the ICU in the average referral hospital is about 50,000 per day. And you have to spend the first 3 to 5 days in the ICU before going to the normal wards. Your family is going to take a toll on that. So families need to learn to be patient. The patient himself needs to learn to be patient with himself and with his family.
Yeah, that's very important. Yes. And when you talked about the diet as well, sometimes, I don't know about you doctors, but I just think the healthier decision is the most expensive one.
Yes.
How unjust is that? Because when you're talking about the kind of oils, when you were talking, I was looking at what the prices at the supermarket, and you're going ka-ching, ka-ching. I'm like, that's so expensive. Are there less expensive options for us to stay healthy at the same time when it comes to diet?
Well, there are less expensive options. You can still use your processed oils, but reduce the quantity that you use.
Okay.
You can switch, like I said, switching from red meats to fish. They are usually the same price for a kilo. Yes. You can try to bake. Some people don't need an oven to bake. There are many methods using a pot, putting some sand in it to bake your food items rather than deep frying them. Yes. And so I cannot tell anybody realistically to never eat out and to never eat processed foods because it's impossible with the kind of context that we live in. People are always on the go. So like I said, maybe if you used to eat processed food every day, that's 7 days a week, reduce to 2 to 3 times. A big change is going to happen from that.
Okay. Is there any other thing, doctor, you may want to add to the viewers, maybe that I didn't ask and you think is important they know about staying safe and healthy when it concerns a stroke?
Well, I think the most important part has been mentioned, but what I want to add is about physical activity. You know, sometimes people think that having physical activity is going to the gym. You know, that's not the case.
Yeah.
Sometimes even 30-minute trek can increase your lifespan. Some studies, I think in 2022, has proven that for a 1 hour walk, when you walk for 1 hour, you improve your lifespan for 1 month.
Yes.
That is, for each 1 hour you are walking a day, you are increase your lifespan for a month. So that's something that you should not wait to have money to go to the gym. Just instead of taking care every day, please just move. You have to just active, because when you're active, that's how the blood circulation in your body is easier and all the rest. So it's important.
Thank you, doctor, for that. Those are less expensive options. It's very important to highlight these options that are less expensive. For example, the gym could cost maybe 25,000. I don't know. It depends on your area. But just standing up and walking costs nothing at all. And actually, it's also beautiful because if you're in a green place, it's healthy for your mind to be in a good environment. Now, the World Stroke Day is going to be marked tomorrow. Do you have an event around that?
Well, for now, apart from this talk and this sensitization that we're doing, we're going to organize a couple of screening campaigns for hypertension and the other comorbidities that accompany that. And also, I would like to highlight one thing. We're in a country that is endemic to sickle cell disease. I don't know if you know it. And sickle cell patients are susceptible to strokes. I didn't want to leave without saying that.
Okay.
They should take their medication. People should get screened. Know your electrophoresis today. Get screened. Get your children's treatment. Stay hydrated. Always go for your checkups, because one of the major complications of sickle cell disease is having a stroke. So I would like to highlight that.
Since you're talking about those who could be at risk,
Yes.
how about male to female ratio?
The male to female ratio is higher. Males are more susceptible, but these days, with the studies are showing trends that the ratio could be getting equal. Yes, because females are adopting more bad habits. Females are drinking more these days. Females are smoking more these days. The sedentary lifestyle as well.
And what about the age group?
The age group is usually, it's earlier in our context. It's usually mid to early 50s in Cameroon, other than 70 to 80s in the other countries. It's maybe because we have worse lifestyles or the genetic makeup, because strokes and other cardiovascular risk factors are higher in Black people. So yeah, would like to keep that.
Okay. See, this is so gloomy and sad. Doctors, please say something nice to us concerning the stroke, or anything maybe that we're doing right we should continue doing. Because I don't want the gloom to be what stays with you this morning. What can you tell us?
Well, I can say there is hope. There is hope these days, because in our consultations, and we are seeing more and more people coming to say, oh, doctor, just check my blood pressure. I have no problem. People should continue doing that. Oh, I heard that my grandmother had diabetes. Please check my sugar. People should continue doing that. I'm seeing a trend in that, and it's really good.
Yes.
Many people are eating more vegetables, eating less salt. They should continue doing that, even without anybody asking them, they're doing it. So I can applaud everybody for that.
Thank you. Perfect way to wrap up this very enriching conversation on stroke. If you're just joining us, we're in conversation with Lamuella Chin, Dr. Lamuella Chin, and Dr. Nsia Freddy. I can't let you both go without responding to our question of the day. As quickly as you can, we have just 1 minute. What's one habit that instantly makes someone appear more professional to you?
Discipline.
Discipline, love that. Well, there's a cheeky smile on your face. What is that one good habit? You just see someone, you're like, that's professional.
Respect of time.
Yes, respect of time. Are you punctual? You watching this morning? Because we are punctual, and it's about time for the news. So we're going to take a break immediately after the news in the English language. We'll come back. There'll be Ask the Expert with Kembeko.